This presentation is a review of venous thromboembolism. VTE is the newest core measure, and it will be added to the core measure list in 2013. Core measures list the minimum standard of care for frequently seen disease conditions. The core measures are meant to standardize care according to evidence-based practice and eliminate practice by ritual. The ultimate goal is to reduce the impact of these conditions on the population. VTE includes deep vein thrombosis, pulmonary embolism, and post-thrombotic syndrome. The signs and symptoms of deep vein thrombosis, DVT, are listed in the VTE handout included in this SWANK module. In your assessment for DVT, look for calf pain or tenderness, warmth, erythema below the knee swelling, and there can also be up to the groin proximal vein thrombosis. It can be warmth and sometimes cyanosis. Pulmonary embolism can manifest itself as tachypnea, so respiratory rate greater than 20 breaths per minute, or dyspnea, tachycardia, so heart rate greater than 100. There can be central chest pain. There can be cyanosis, sudden collapse, coughing, sweating, hemoptysis. Post-thrombotic syndrome can result in lifelong difficulty with leg pain, lower limb swelling, venous leg ulceration, varicose veins, venous hypertension, and superficial thrombophlebitis. The signs and symptoms for VTE can be found on the venous thrombosis handout. You need to print it out of SWANK if you need a copy, and it's in the lower left-hand corner. Expectations of the VTE core measure are listed here. Every patient should be assessed for VTE upon admission and throughout the continuum of care. If the patient has risk factors, we must provide and document VTE prophylaxis or document why not. Important indication here would be the segmental compression devices. We need to make sure they're documented on and when they're off. And I think that occurs on the SCPCP. And on surgical floor and medical floor, I think that occurs on the graphics record. In the patient that presents with VTE, there must be evidence of 5 days of overlap therapy. That may start in the hospital, the subcutaneous low molecular weight heparin, in combination with the oral Coumadin, for example, and until the patient's INR is therapeutic. So this might extend into the patient's self-management after discharge. Then discharge teaching becomes key to the patient's self-management of the medication regime and worsening signs and symptoms and contraindications with other medications, especially supplements, vitamin supplements, and other types of medications that the patient might take over the counter. The core measure checklist currently at the printer has been updated to include reminders about assessing for VTE on every patient, and there's also a section there for VTE prophylaxis education in case the patient has risk factors. The Partners in Wellness form is given to every patient at discharge. Look for updates in the Partners in Wellness form. The new form includes a section on clot prevention, and it should be available by January 1st, 2013 for you to use with all of your discharge teaching. The core measures checklist has also been updated. The second page now includes place for patients who have had VTE, and it includes their discharge teaching to address compliance with the medication and follow-up and dietary advice and information about potential adverse drug interactions. A discharge teaching sheet for VTE is also being developed at the printers and should be available by the 1st of January 2013. This is prepared to help standardize the instructions the patients get about self-care, their diet, their medications, and their symptoms of worsening condition. And of course, the important piece is the compliance with medication and follow-up monitoring for the anticoagulation. In summary, to meet the new VTE core measure, we must be alert to DVT and PE signs and symptoms. We start that assessment upon admission, and we want to encourage patients to do early mobilization, leg exercises, and then of course if we have prophylaxis in place, we want to make sure that the segmental compression devices are fit properly and that they're working properly, and we need to make sure we document when they're on and when they're off. Of course, if the patient's receiving therapy as prophylaxis, drug therapy, we need to monitor for bleeding complications, and of course it's important to educate the patient to report any unusual bleeding. Providing information on prevention of VTE probably involves lifestyle changes like weight loss, don't smoke, regular exercise. Of course, providing patients on oral anticoagulants, info on medication, and the foods that affect the INR are important, especially with the overlap therapy, and then educate patients and their families about signs of DVT and PE and the treatment of the same. Thank you for reviewing this session on VTE, the newest core measure.